Have you ever wondered what a panic attack is? Have you ever had extreme waves of anxiety or fear? Have you ever had a panic attack and then worried about having more panic attacks? Or have panic attacks made it hard for you to leave your home or to go into public spaces? Stay tuned in this video to learn more about panic disorder. As I said before, I'm going to be talking about what panic disorder is. And I'll also be talking about what a panic attack is, what are the signs and symptoms of panic disorder, how common it is, what causes panic disorder, as long as how does it present over time. And if you stick around to the end, I'll be sharing an evidence-based strategy to deal with panic attacks, as well as an awesome joke. The first and most important thing about panic disorder is that you need to have recurrent and unexpected panic attacks. And so that means that we need to know what a panic attack is. A panic attack is defined as a sudden surge of intense fear or intense discomfort that reaches its peak within minutes and comes along with at least 4 of the following symptoms. Those symptoms include palpitations, or feeling like your heart's pounding in your chest, or your heart beating faster. It could also include feeling a sense of tightness in your chest. People struggle with shortness of breath or difficulties breathing. There's also sweating, trembling or shaking, feelings of choking, feeling nauseous or feeling very uncomfortable in your abdomen, feeling dizzy, unsteady, lightheaded or faint, having chills or heat sensations, paresthesias, which means that you're having either some numbness or some tingling throughout your body. You could also have 3 of the following psychological symptoms that come along during a panic attack, where you experience derealization, where things don't feel real around you, or depersonalization, where you don't feel like yourself, or you feel like you're being detached from the person that you are. You can also have fear of losing control or going crazy, or lastly, a fear of dying. So those symptoms in the context of an intense and sudden surge of fear or discomfort makes up a panic attack. The other features of a panic disorder include that after having one of those attacks, it's followed by at least a 1-month period where the person worries constantly about having more of those attacks, or there's a big change in their behavior, such as avoiding certain places or people so that they won't have further attacks. You also want to rule out other things that could be causing these attacks, and that includes other medical conditions or substances of abuse like alcohol or cannabis, or medications that someone might be taking. You also want to rule out other mental disorders like depression or other anxiety disorders, or, like I said, a substance use disorder. Some of the important features of panic disorder include certain situations causing panic, where, yes, most of these episodes are supposed to come out of the blue, but usually what happens is that the person very much knows which situations, people, or places will cause them to have a panic attack. This could include being in public places, being in social situations, being alone, or having to perform in front of a bunch of other people. And once these are recognized, a person with panic disorder starts to avoid those things because of fear of having another attack. The next one is physical hypervigilance, where someone may be monitoring physical symptoms in their body which are unexplained and happen to a lot of people, by doing things like maybe checking their pulse to see if something else might be going on, and they're worried that something like maybe having a heart attack might be happening. The next one is catastrophizing, and what that means is that in those really stressful situations, the person worries about the worst possible thing happening in that situation, where they may worry about maybe having a heart attack, having a stroke. They might have concerns that they're going to have more panic attacks, or they're worried that they're going to go crazy or lose control. And the worries really depend on who the person is and what they fear most. And that's going to be what comes out in those panic attacks. People with panic disorder also struggle with correcting those automatic thoughts, as a lot of people will have physical symptoms like they have throughout the day and at various points in the day. However, when people who don't have panic disorder experience those symptoms, they may have a thought about, am I having a heart attack or am I going to die? But soon afterwards, they're able to correct some of that thinking and challenge those thoughts with other thoughts. Like, well, no, I'm pretty young and healthy. My doctor told me it wasn't a heart attack and I'll be fine. And so that's usually enough to get that person out of that state of worry. But with panic disorder, they have troubles with that correcting process where they can't get their mind off that thought that this might be a heart attack, or there's lots of what if questions that come up, like, well, what if this is a heart attack and this is just the one time that it's going to happen, or what if my doctor was wrong about saying that? And those worries can get really problematic for the person. The next one is that people with panic disorder engage in safety seeking and control, where they start to believe that the only way to deal with these panic attacks is to prevent them from happening and avoid triggers. And so avoidance, escaping, and lots of other safety-seeking behaviors start to become a big issue for that person. Panic attacks are usually spontaneous at first, where they don't have any identifiable trigger, but they usually do follow certain things like physical exertion, or it could follow things like excitement and having things like emotional trauma happen to you. But it could also be things like sexual activity as well. Anything where the body's going to experience physical symptoms. To understand these attacks a little bit better, one should start to analyze some of those triggers for the attacks, where you're looking at how much caffeine are you drinking, how much alcohol or nicotine are you using, how much physical activity are you getting, and your sleep and eating patterns, and how your physical health may be impacting your mental health. Panic attacks can usually start off and gradually and very rapidly increase in their intensity over a 10-minute period initially. And these periods will go on for about 20 to 30 minutes and rarely longer than an hour. And that would be a very defined panic attack. Other people can have high levels of anxiety which go on for much longer, but those wouldn't necessarily be called a panic attack and may just be experienced as high levels of anxiety in that person. People may experience depression or depersonalization where they don't feel like themselves during these attacks. And these symptoms can resolve either really quickly or may take some time to resolve. But the attacks may be followed by worries of having more of those same attacks. In people with panic disorder, there's a higher risk of suicide, and this should be monitored in someone who does have panic disorder. People with panic disorder can also experience nocturnal panic attacks, where someone wakes up in the middle of the night with some of those symptoms that we talked about before and in a very anxious or fearful state. People with panic disorder and panic attacks may be more sensitive to medication side effects, and when they do have side effects, they can be affected much more than someone without those concerns, because they're always hypervigilant about physical symptoms in their body. There may be extreme attempts to avoid having more of these attacks, and that includes abusing substances like alcohol, cannabis, nicotine. It could also be restricting the types of foods that they eat because they're worried that those types of foods are going to cause more panic attacks. It also could prevent them from taking medications because they're worried about side effects, and that might actually be really bad for their health. What can be helpful during a panic attack is actually that thing that you see in the movies where people are breathing into a bag. And what that helps people do is bring more carbon dioxide back into their blood and actually helps balance out their body a bit more and brings it back into a normal state. Panic disorder is a relatively common disorder where 1 to 4% of people will experience panic disorder in their lifetime. more women than men will be diagnosed with panic disorder, but there are no differences between races or ethnic groups as to who will go on to develop panic disorder. The only social factor which increases the risk of having panic disorder is a history of divorce or separation. And it usually presents in young people with a onset usually happening around age 25. With regards to other conditions that come along with panic disorder, up to 91% of people with panic disorder will go on to have another psychiatric condition or another mental illness. 1/3 of people who have panic disorder will have had a major depressive episode or major depressive disorder before they had and been diagnosed with panic disorder. 2/3 of people with panic disorder will have depression at the same time or after developing panic disorder. Up to 30% of people that have panic disorder will also have another type of anxiety disorder as well. And that could include things like PTSD and OCD as well. Substance use disorders is also very common in people with panic disorder as well. People with panic disorder have been shown to have differences in their sympathetic nervous system, and that's the fight-or-flight response in people. So what can happen in people with panic disorder is that they take a long time to adapt to new stimuli, or something that's going to cause them a lot of anxiety. It's going to take them a longer time to get used to that. And they have a much bigger response to something that's going to cause them anxiety than other people would. The chemicals that are different in people's brains with panic disorder include norepinephrine, serotonin, and GABA. And we know that these are the case because the medications that we use to treat panic disorder involve changing the levels of those chemicals in the brain, which are effective. The areas of the brain that are involved in panic disorder include the locus ceruleus, which is the center for norepinephrine, or that exciting neurotransmitter that helps people focus or get energized for a certain thing coming up. It also involves the raphe nucleus, or the red nucleus, which is the center for serotonin, which is the feel-good neurotransmitter. It also involves the limbic system. The last part is the prefrontal cortex, or our planning or control center, which helps plan out how we're going to avoid certain situations and avoid from having more attacks. Genetics plays a big part in panic disorder as well, where a first-degree relative of someone with panic disorder will have a 4 to 8 times increased risk of also having panic disorder. And they've also done studies on panic disorder, which showed that if one twin has it, the other twin is much more likely to have it as well. There's also a big relationship between life stressors and the development of panic disorder, where in one study, they found that 60% of women with panic disorder had a history of childhood sexual abuse, as compared to 31% of women who had another anxiety disorder. Another thing that increased that risk was being separated from one's mother at a young age. Some other themes in panic disorder include things like having difficulties controlling anger or a chronic feeling of being trapped. There may also be significant emotional issues with being separated from an important person in their life, either in childhood or as an adult. It may be triggered by a significant stressor in school or work where they have increased responsibilities that are put on them. Children that go on to develop panic disorder may also view their parents as controlling, demanding, and critical. The risk factors for developing panic disorder include neuroticism, or a high tendency to experience negative emotions, but also anxiety sensitivity, where someone is much more likely to misinterpret a physical symptom in their body. Some other factors include a history of fearful spells, where they're almost like mini panic attacks, having a lot of the same features, but not as many features, or it's not as impairing. Some other things include having severe separation anxiety and really worrying about being away from other people when you were a small child. Sexual or physical abuse is also common and increases the risk of developing panic disorder. Smoking is a risk factor for panic disorder, as is asthma. And what you usually see is that there is usually a identifiable big stressor, like someone passing away or something bad really happening to someone else in their life prior to the first panic attack happening. And as always, genetics plays a big part. And so if there's a family history of panic disorder, that makes it much more likely that panic disorder is going on as well. With regards to the course over time with panic disorder, it's usually a condition that is chronic, but it can fluctuate over time, where people might have symptoms that are worse at some periods in their life, but better at other periods in time. And so, but most people will have some resolution from those symptoms. In fact, 30 to 40% of people that were diagnosed with panic disorder will go on to have a full recovery. 50% of the people will go on to have just minimal symptoms or just very mild symptoms and not really cause many problems in their life. And anywhere from 10 to 20% of people will continue to have problematic symptoms and struggle with avoiding things in their life that it becomes a big issue for them. One interesting thing about panic disorder is that people usually hide the symptoms from people that care about them or people that are close to them. And so that people usually don't know that they've been struggling with these things. It's also the case that nicotine and caffeine can cause these symptoms to worsen or happen in the first place. Some good factors for treatment of panic disorder include if the person was functioning really well prior to being diagnosed with panic disorder and was going to school or had a job and had lots of good relationships. And another thing is that if they had really a short duration of symptoms, that they weren't there for very long, or that they were very brief or mild symptoms. And those are going to be signs that it's going to be easier to treat that, and they're going to get better much easier. And so that's the importance of seeking out care early when you're having these symptoms, so that you can get better and you can receive that treatment and get better over time. So that's it for talking about panic disorder today. We didn't get into treatment, and there may be future videos about that, but if you do want to hear more about some general treatment options, you can check out my video on what anxiety disorders are, and that has some general discussion about what the different treatment can be. I wanted to get into the strategy to help you guys deal with panic attacks, and that's called anti-panic flashcards. What that's going to be is developing a bit of a strategy with these either flashcards or something on your mobile device like a phone that's going to help you cope in those situations. So first off, what you want to do is you want to pick a time where you're not feeling anxious very much at all. And if that doesn't happen, then finding a time when you're less anxious to start to go through and figure out, looking back at the panic attacks that you've had, and what are some of the triggers, and start to write those things down to figure out, well, what's causing this. Next, you want to write down the thoughts that typically come up during an attack that you have. And that could be things like, I'm going to die, or I'm having a heart attack, or lots of other things. And it's very specific to each person. But you want to write that down beside each of the triggers that you've written down already. Next, what you want to do is pick one of those triggers and the thoughts that come up when that trigger happens or when you start to experience those symptoms. And what you want to do is, once you have those thoughts that come up, beside that, start to write down some alternative explanations as to what might be going on in that situation. Say, if you're experiencing chest pain and you're thinking that you might be having a heart attack, some other things you could write down to help fight against that explanation are, I'm feeling anxious right now, or this is my anxiety. And those things are going to be helpful to combat those really strong thoughts that you have during an attack. The next part is the really hard part, where while you're having an attack or while it's starting, you're going to pull out that flashcard or pull out your phone and start to read those explanations that you came up with over and over again until you're through that panic attack. Now that's extremely hard, and you're probably not going to believe it when you first start doing it, but it's really important that you just keep on reading it over and over again. And over time, usually what happens is that you start to believe it, well, just a little bit more, and then a little bit more. And then eventually, if you do it enough over time, you will start to believe that alternative explanation as opposed to, I'm gonna die, I'm having a heart attack. All right, now's the time you've all been waiting for, and I've been waiting for it as well. But here's the joke that is, well, as I believe someone said before, it was awesome. But why does Dracula have no friends? Because he's a pain in the neck. All right, well, thank you guys so much for watching. I really appreciate your time and your attention. I hope that you learned something from this video and that you got some value from this video. If you did, I'd really appreciate it if you gave that like button a little tickle and did the same thing for the subscribe button. And share this video with as many people as you can to hopefully help as many people as you can, as that's my intention in creating these videos. My name is Andrew Dutcher, and this is my channel, Mental Wealth. Thanks so much for watching. Take care.